All right, welcome to The Explainer. Today, we're diving into something called diabetes insipidus. And right off the bat, I've got to tell you, its name is super misleading because this has absolutely nothing to do with sugar. It's all about a massive, uncontrolled loss of water.
Okay, so just think about this for a second. What if your body just couldn't hold on to water? I mean, no matter how much you drink, it just flowed right through you. That's the core problem we're going to unpack today, and it's the daily reality for someone with diabetes insipidus.
So let's get one thing straight right away. When you hear the word diabetes, your brain probably jumps straight to sugar, right? To insulin. Well, this is the other one. It's a totally different story, one that's all about water, not sugar. And this really breaks it down perfectly. The diabetes we hear about all the time, diabetes mellitus, that's a glucose or sugar problem. It's all about the hormone insulin. But diabetes insipidus, we'll just call it DI, is a water balance issue, and the key player is a totally different hormone called ADH. So yeah, they share a name, but they are completely, totally different conditions. Okay, so to really get why DI is such a big deal, we first have to talk about how things are supposed to work. Your body has this incredible, finely tuned system for staying hydrated, and honestly, it's pretty amazing. And the star of the show is this guy, anti-diuretic hormone, or ADH. You know, the name kind of gives it away, right? Anti-diuresis literally means against peeing. This hormone is basically the boss that calls up your kidneys and says, hey, stop, hold on to that water, we need it. And here's how that whole system works. It's this beautiful little four-step dance. It all starts in your brain. Step 1, your hypothalamus, it's like a sensor, detects you're getting dehydrated and it makes the ADH. Step 2, the pituitary gland releases that ADH into your blood. Step 3, the ADH travels all the way to your kidneys and plugs into its special receptors. And finally, step 4, the kidneys get the message and do their job. They pull water back into your body. It's so elegant, so effective, and absolutely critical. So, what happens when this perfect system breaks down? Well, it turns out there are two main ways it can fail, and that's what gives us the two main types of DI. I think this is the best way to understand the difference. Just think of it like a text message. With central DI, the problem is with the sender, your brain. The message, ADH, is never even sent. But with nephrogenic DI, the message gets sent just fine, but the receiver, your kidneys, can't read it. Their phone is broken. So one is message not sent, the other is message not read. Simple as that. And if you look at the causes, it makes total sense. Central DI, the message not sent problem, is usually caused by something going wrong in the brain. We're talking head trauma, brain surgery, that kind of thing. But nephrogenic DI, the message not read problem, well, that's usually an issue with the kidneys themselves, like chronic kidney disease or even side effects from certain medications like lithium. But here's the kicker. It doesn't actually matter how the system broke. Whether the message wasn't sent or just wasn't read, the end result is exactly the same, and it's dangerous. The kidneys just can't conserve water. It's like the floodgates are stuck open. And once those floodgates are open, it kicks off this cascade of problems. A real domino effect. Your body starts screaming for help with some really obvious danger signals. I mean, just look at this number. Up to 20 liters a day. That's not a typo. To give you some perspective, that's like more than 5 gallons of water. Can you even imagine? It's the most dramatic sign you can get that the whole system has crashed. And as all that pure, clean water is rushing out of your body, think about what's left behind in your bloodstream. Everything else gets super concentrated. And the one we worry about the most is sodium. When that sodium level gets above 150, we are officially in the danger zone, especially for the brain. So all the symptoms make perfect sense when you think about it. You've got that extreme urination, which is called polyuria. That, of course, leads to an unbelievable thirst. That's polydipsia. And as all that volume leaves your pipes, your blood pressure can drop really low, which is hypotension. And all the while, that sodium is getting more and more concentrated in your blood. That's called hypernatremia. And this right here is why DI can be so incredibly dangerous. Think of that super high sodium in your blood like a powerful magnet for water, and it starts pulling water out of your brain cells. The cells literally start to shrink. And when brain cells shrink, you get these scary neurological symptoms, confusion, irritability, and if it gets bad enough, seizures. Okay, so we've established the system is broken, and the consequences are, well, they're really serious. So how do we fix it? It's all about figuring out where the breakdown happened, and then stepping in to restore that delicate balance. And the treatments are super logical, they're tailored right to the specific problem. For central DI, remember, that's the message not sent problem, the fix is pretty straightforward. You just give the message yourself. There's a synthetic version of the hormone called desmopressin that does the job perfectly. But for nephrogenic DI, the message not read problem, sending more messages won't do any good, right? Instead, you have to fix the receiver. You treat the underlying kidney issue. And sometimes, interestingly, other meds like thiazide diuretics can help. They kind of trick the kidneys into holding on to a little more water, which helps reduce the total amount you're losing. So you can see, managing a patient with DI is all about intense monitoring. We're talking strict tracking of every drop of fluid in and out, daily weights to see the bigger picture. We're watching that sodium level like a hawk, especially if it starts creeping over 145. And, of course, we're keeping a close eye on blood pressure. But honestly, the number one priority? Watching for any sign of confusion or change in mental status. That's the first red flag that the brain is in trouble. And this quote right here, this really sums it all up. This is the main takeaway. Yeah, the massive amount of urine is dramatic, but that's not the real threat. The true danger of DI is the chaos that unchecked water loss unleashes on the brain and on your circulation. That's the real life and death stuff. It really makes you stop and think, doesn't it? This whole intricate system for managing water is just one of hundreds, maybe thousands, of hidden processes that are working 24/7 inside you to keep everything in perfect balance. So it kind of leaves you with a question: what other amazing systems are working inside you right now that you don't even know about?